Lascan Corla. Minister, it is with great pride that I speak on behalf of Sinn Féin on this historic piece of legislation. The points I intend to raise today are done so in the spirit of cooperation, and I wish to be as constructive as possible regarding the legislation because it is incredibly important that we get this right. The reason it is so important is that we have seen right across the world that once abortion laws are passed, it is sometimes very difficult to revisit them. We need to pass this legislation quickly, but we must also make sure it works and it delivers for women. The legislation we have in front of us today will go down in the history of this state as being some of the most important legislation that we will ever pass. But that cannot distract us from our duty to get it right for those who will need to avail of abortion services, as well as for those clinicians who will provide these services. We are here with a mandate from the Irish people, a mandate cemented with 1,429,981 votes. Those people are today willing us to do our job, to work constructively and to get this right. The public discourse during the referendum campaign reflected people's understanding of abortion as a healthcare issue that should be addressed through progressive, patient-centred legislation and not by criminal sanction. And it is with criminal sanction that I want to begin. The general scheme of the bill had offences and criminal sanctions as section 19 at the end of the bill. Therefore, I was shocked and surprised when the bill was published to see offences and criminal sanctions moved to section 5 at the very front of the bill, and as I had said to you, Minister, right in the front window, which I don't think is the appropriate place. In a piece of legislation to regulate for the provision of abortion, we are confronted with crimes for carrying out an abortion outside of the scope of the bill before we ever see mention of the provision of abortion. I find that shocking, and I would like to know and to understand the motivations of the drafters in so doing. What it has done is, in effect, to perpetuate the chilling effect that clinicians feel and the continuation of the stigmatisation of abortion. Throughout the hearings we had at the Joint Oireachtas Committee on the 8th Amendment, nearly every single clinician who gave evidence spoke of the chilling effect of the 8th Amendment and spoke of the effect that that chilling effect had on their ability to provide healthcare to women. Yet here we are with a bill to legislate for abortion, and we see the rewriting of the 8th Amendment into legislation. Professor Fergal Malone and Dr Rona Mahoney were very clear on this at the committee. They said that currently doctors cannot even pick up a phone to make a referral. If we cement this chilling effect into the legislation by telling doctors first, this is what you're specifically not allowed to do, before we eventually tell them what they are allowed to do, then we will do just that. I would ask the Minister that the offences in the criminal sanctions section is moved to the rear of the bill. It would be remiss of me not to say that while I use the word abortion and the bill is to legislate for abortion and access to abortion, there is not a single mention of the word abortion in the bill. Furthermore, there is just one reference to access, and that is in the offences section. So in legislation that is to provide for access to abortion, we have one mention of access and no mention of abortion. Minister, abortion is not a dirty word. It wasn't a dirty word in 1983 when the 8th entered the Constitution, and it isn't a dirty word in 2018. Over 3 years ago, her.ie published a fantastic piece entitled "We need to stop treating abortion as a dirty word." The opening paragraphs of that article stated, "It is rare that the word abortion is said in anything other than an apologetic, hushed tone in this state." It further goes on to say that abortion has been treated by the majority of people in this country as a dirty word, heavy with stigma and representative of an act that must be covered up and denied at all costs. While the referendum campaign, I believe, has changed that fact, and now abortion is not viewed by so many in those terms, there is the residual effect that stigma has, and this is evidenced in the drafting of the bill. Minister, I would ask you to look at ensuring that reference to abortion and access to abortion is contained within this legislation, because if we don't try to challenge the residual effects of the 8th Amendment here in the legislation, then there is the possibility that those effects can live on and can grow and still be present in our society. Previously, when we met to discuss this legislation, I relayed that I had been asked by many stakeholders and LGBTI groups and by repeal campaigners that reference be made in the legislation for pregnant persons, so as to cover people who can get pregnant but who do not identify as or are not women. I know one thing that was apparent in the referendum was that the LGBTI community and the trans community played a huge part in the campaign. They did so in Fingal Together for Yes, and they did so right across the state. Trans people, and particularly trans women, are an inextricable part of our feminist community, and it would be remiss of us not to ensure that the legislation regarding the provision of services leaves them out. We have to make reference within the legislation to people and persons who can be pregnant. And I've spoken to you about this, Minister, and hopefully we can sort this out via amendment. On the issue of the 3-day waiting period, I believe that we must listen to medical experts. That is the one thing that the referendum taught us, is that on issues like this, we have to listen to women and we have to listen to medical professionals. Many medical professionals have expressed concern that such a measure will restrict access to abortion services. I think it is somewhat paternalistic to claim that if a person attends a GP to avail of an abortion, that she hasn't thought it through, that she hasn't given her full consideration, or that she's unsure of what she might wish to do. You know as well as I do, Minister, that no woman takes a decision such as this lightly. And what this measure will do is restrict access in general, but it will also restrict access to marginalised groups, for women in abusive relationships, for those with a disability, and for those in direct provision, among others. It will also affect those in regional, less populated areas, where they may not want to attend their local GP, where they have to go to Dublin or to Cork or to another large town or city. This will place additional burdens on them in terms of time, travel costs and other costs. I know my colleague Megan Fearon, MLA, who was leading our campaign in the North on this issue, is watching this debate today. And I must say that such a waiting period will, for the women in the North who may need to access abortion services, act as a significant deterrent. I extend my best wishes to my northern comrades who are still fighting for access to abortion. I can assure them of my help and my support, as well as that of my party. It seems that the 72-hour provision was a political decision. It wasn't part of the committee report, as was stated recently at the committee by one of the members, quite oddly to me, but it wasn't part of our deliberations and it wasn't part of our report. Now, reference has been made to how it may have got into the legislation, and that's fine, that's a matter for yourselves, but it wasn't on the advice of clinicians, and indeed many clinicians have spoken out against it since. We in Sinn Féin will be guided by doctors and medical professionals on this matter, and I have a number of stakeholder meetings completed and many more to go regarding this legislation. I believe that the conscience clause in section 23, subsection 3 of the bill is appropriate. It will protect those who, for whatever their own reasons are, do not want to provide this service, but first and foremost it will protect women. For the avoidance of doubt, we do not agree that medical professionals who invoke the conscience clause should be exempt from referring a patient for the necessary medical treatment that they seek. Women who need medical treatment must be protected, and they must be at the centre of this provision. I am glad of the commitment that you have given, Minister, that the services will be provided free of charge. It is important that there are no barriers to access in this regard. With that in mind, I would like to say that we need to be sure that these services can go live in January 2019, and to do that, medical and healthcare professionals must be engaged with, and at this stage must be engaged with in a very intensive way. It is they who will deliver the services, and it is important that they are involved and that their input is reflected in the services that we will be providing. I would like to welcome the announcement that Dr Peter Boylan will assist in the implementation and preparation of abortion services. Indeed, I would like to congratulate Dr Boylan on his appointment. He is an eminent and accomplished clinician who has been to the forefront of women's healthcare in this state for many years. As a consultant obstetrician, a former chairman of the Institute of Obs and Gynae and a former master of the National Maternity Hospital, he is exceptionally well qualified for this role. He played a prominent role in the campaign to remove the 8th Amendment from the Constitution, and he provided excellent evidence and information to the Oireachtas 8th Amendment Committee prior to the referendum. I look forward to working with Dr Boylan to ensure that the Health Service provides world-class abortion care for our people and that the ancillary recommendations of the report of the 8th Amendment Committee are implemented in full, because it is only by implementing the ancillary recommendations along with the other recommendations that we will be able to do any justice to women seeking services. Once we have passed this legislation and implemented what I hope will be world-class abortion services, it is important that focus is turned to implementing the ancillary recs of the 8th Amendment, including the 8th Amendment Committee, including up-to-date, objective sex education and free contraception. And I don't think I was the only one surprised at the committee to find the type of sex education that our kids are getting in school. It was an eye-opener, and really not in a good way at all, I don't think, for anyone on the committee. The fact that it's not regulated is very worrying, because all we are doing is storing up more problems. We have to be able to provide kids with objective information and just information, not judgment, not moralising, none of that. We need to be able to provide them with information, and that came out very strongly during the course of our hearings. So if we're going to do this justice, we need to do all of it. I think we'll also need to see improvements in maternity care for those who wish to have a child. This means the full rollout of the National Maternity Strategy with funding, not just announcements, not just paper. It has to be backed by funding. We need to invest in our midwives and increasing the number of midwives that we have. We need to invest in increasing the number of obstetricians and gynaecologists that we have. And we also need to ensure that we have affordable childcare and mandatory paid maternity leave. But that debate is for another day, and we will have it at some point, Minister. We will be submitting amendments on this bill in order to ensure that it is in line with the recommendations of the Joint Oireachtas Committee on the 8th Amendment and the Citizens' Assembly. We must ensure that this legislation respects the result of the referendum and that it will deliver for those who will need abortion services. I know that you are committed to that, as we are in Sinn Féin, and we will work with you in an efficient and constructive way to make that a reality. And while I have a few moments, if I could, I just want to say a few words of thank you to people. So I want to thank my comrades and my friends in Sinn Féin, because they debated, they listened, they voted, they participated fully in an open and democratic way at our Ardeshna, and it wasn't easy. It wasn't easy for them at all. It was an extremely emotive and difficult topic for many people to wrestle with, but they took some guidance, they listened to evidence, and they came to a decision, and we will back that decision of our members at every opportunity to vote. I want to say thank you to those people who worked hard to repeal the 8th Amendment, people like Alva Smith, who gave their whole life to it, and the men and women in Fingal Together for Yes, because we did a lot of campaigning together. We wore out a lot of shoes, and indeed you came yourself, Minister, to one of our events, but we wore out a lot of shoe leather, and we tired out our voices, but we got there in the end, and we achieved over 77%, which I think is really a tribute to the people who gave their heart and soul to it. I also want to briefly say a word, and I know I've often mentioned my parents, but on this issue they are They were extremely well foresighted in terms of how they viewed in 1983 what would happen. They campaigned against the insertion of the 8th Amendment, and they brought their two daughters up to believe that you should never ever apologise for standing up for women's rights. So I know my mum is watching this, so I'm going to say, Mum, we're nearly there. We're nearly there. And I did get very emotional coming in here, which is not like me, but this is very, very important. And all I can say is Sinn Féin will work with you. We won't pull against you. We are in opposition, we know that, but we want to get this done, and we want those services ready for January 1st, 2019. Good night.